on Facebook later. So again, welcome, and thank you, Dr. Mejia and Dr. Guzzardi, for jumping in and talking about knee pain and dealing with that, especially now, while most people are just not very active, not moving as much. Certainly some are doing their best, but we had a number of folks asking to dig into this topic a bit. And so if you're a participant in the webinar, welcome, glad you're with us. Do want to address any specific questions that you have, so please use the Q&A feature on the bottom of your screen, and we'll do our best to address those. For those that don't know them, I'll introduce our panel here. Dr. Joseph Mejia is triple board certified in physical medicine and rehabilitation, sports medicine, and interventional pain management. He's been with performance rehabilitation and regenerative medicine for about 10 years and really has spearheaded the regenerative medicine revolution at Performance, but not just at Performance, really on the East Coast. I mean, 7, 8 years ago, there were very few people doing regenerative medicine, stem cell therapy, PRP. As a result of that, Dr. Mejia has really become an extremity specialist, even though he deals a lot with the spine and does a lot of spine related procedures. But he's due to the regenerative medicine, which has been knee, shoulder, hip for so many years, he's kind of become a specialist in that area, but now does regenerative medicine for the spine as well. Dr. Guzzardi has been with Performance for a couple of years, helps to lead the physical therapy department in our Watchung clinic, and just brings years of experience dealing with, again, both extremity and spine conditions, but works a lot with knee injuries, a lot of post-surgical rehab, and very complex conditions at that. At Performance, we're dealing with complex orthopedic conditions. So not as much the simple sprains and strains, but degenerative issues and injuries that really many doctors or facilities don't really know what to do with. And oftentimes people in those situations are directed towards surgery. And sometimes surgical intervention is necessary, but what we've found, and I think these guys are going to speak to that, is that oftentimes that's not necessary and really should be a last resort. So let's jump right in, and going to open it up first with Dr. Mejia and just kind of ask you to maybe identify what are just some of the more common conditions and maybe even symptoms that people experience that ultimately bring them into your office.
Sure. Yeah, thanks for the introduction. That was very kind. Yeah, so knee pain, I would say in our clinic, is one of the most common conditions that we treat. The knees are weight-bearing joints of the body, and they're subject to wear and tear. They're used literally every day, and they, just like any part of the body, that the cartilage wears thin and it can wear out. So some of the conditions that we see most commonly are things like degenerative joint disease or osteoarthritis, which again is just wear and tear of the joint space. But there's a lot of other conditions, and diagnosis is key. A lot of times it's really the history that gives us most of the diagnosis, but we also, of course, have to do a physical exam. Sometimes it's a little bit challenging with telehealth, but in the office as well, we use diagnostic testing such as X-ray, ultrasound, and MRI to really understand what the problem is so that we can get to the diagnosis. Like I said, most commonly it's osteoarthritis, but there's a lot of other things that can cause pain. There's ligaments, tendons, and our goal is really to identify what's generating the pain. And as Dr. Guzzardi can probably support, the muscles and the supporting tissue around it are very important as well. We have to evaluate for that.
Yeah, that's helpful. Thank you. I think you said that very well. I mean, diagnosis is key, right? And I think we tend to forget that. We want the solution. We want to get better. We're looking for any help we can get as patients. And oftentimes, even in the medical field, we come across, providers where, they're just throwing solutions at the symptoms rather than maybe the root cause. And so certainly at Performance, that is a key goal right from the very beginning, is to properly diagnose. Dr. Guzzardi, what are some of the things that you see or hear patients, often, complaining about?
Sure. Yeah. In terms of knee pain itself, it can certainly be on various locations of the knee, and that really kind of goes back to what you were mentioning about the root cause, or the why some of these conditions or these injuries are happening. And usually what we've found, especially at Performance, is the body kind of works in regions where there's a stability component and a mobility component, and they tend to be opposite of each other. So the knee is a relatively stable joint. On opposite ends, above and below, would be the mobility joints, the ankle and the hip. So oftentimes what we see is there's usually a lack of mobility in one of those areas. So sometimes folks who have limited ankle range of motion is getting a little, leading to some injury at the knee, or sometimes it's limitation at the hip. Sometimes it's muscle weakness in a certain particular region, from lack of stability versus lack of mobility. So those two things can certainly play a role quite a bit.
Yeah, that's okay. You bring up some interesting points, right? Again, even just getting down to the root cause of that pain, which may not be in the knee, right?
Yes.
It may not be a knee condition, but a condition elsewhere that's putting strain on the knee. So yeah, and we see that even with back pain, right? I mean, and back pain can be so debilitating. We tend to overcompensate, and it throws our whole body off. Which is why some of those diagnostics that Dr. Mejia talked about are so key. So beyond diagnosis, so what are some ways that potentially someone stuck at home may be able to, not that we're recommending people start self-diagnosing, but if I've got knee pain, are there particular ways that an individual can maybe identify whether or not it's the knee or whether it's something else, and when should they seek help? Dr. Mejia, you want to?
Sure,
or either?
Sure. Yeah, I can take that. Yeah, I mean, the good thing is that with knee pain, if there was no acute injury, most of the times the symptoms are relatively minor, in the sense that they can initially be treated at home. I think in terms of treatment, ice is one of the places to start. I think it's a great anti-inflammatory, a great pain reliever. Like you mentioned, a lot of people are not quite as active, and that may be good and bad, right? If you spent a lot of time, at your job on your feet all day, or, commuting, and you're not doing that anymore, that may actually be good for the joints. But at the same time, a lot of times when people are home, they may actually be doing a little bit more activity, like a lot of yard work. I know in particular, I bought a lot of mulch and I've got to put that down. So that's a lot of physical activity that I'll be doing, which I don't normally do in an office setting. But icing can be, a really good initial treatment. If there was an injury, on the other hand, that would be reason to come in a little bit earlier. But most of the time, if it's just a little bit of pain, a little bit of swelling, some ice, some over-the-counter anti-inflammatories, which right now, unfortunately, is a little bit controversial in the sense that, high doses of anti-inflammatories can suppress the immune system. So as long as you're taking it very sparingly as needed, that would be fine to mitigate some of the pain.
Doc, thank you. Dr. Guzzardi, you were going to mention a few things?
What I did was I actually put together just a tiny PowerPoint. I don't know if I could share that, just kind of going through some of the most common movements, I guess, if that's
sure.
Okay.
Yeah, that'd be great.
All right. Is everyone able to see that? You able to see it?
Okay. We've got it. Thank you.
All right. So, pretty much, what I've outlined is basically the most common things that can definitely help someone regardless of the cause of where, why this, someone is experiencing knee pain, and some of the things that we see at least most commonly, right? So we kind of spoke about the hip and the ankle a little bit earlier. So the first motion here is a hip flexor stretch. which is his primary motion. So the person's in like a half kneeling stance and they're leaning forward with their back nice and upright. But if that person were to lean a little bit more forward, the foot that's down, so this person's left side, if you were to lean a little bit more, you're actually getting a little bit increased ankle mobility, which can be very helpful as well. Oftentimes we'll see in runners and sometimes swimmers, the ankle just won't move as freely as we would like. So that's something that can contribute to some knee pain there. One of the other most common ones here is the IT band, which can sometimes get compressed. I find that it's usually kind of linked to some hip weakness, or if there's some instability somewhere else. And I find that the IT band will kind of compress along the knee a little bit, and that can be very uncomfortable. And that's where a lot of folks will often find some tenderness along the outside part of the knee. So you could either take a belt, a rope. If some folks have their stretch out straps, you can even make a loop at the end of a long bath towel, and just kind of pull the leg up and over to the side. And that should usually give some good relief as well. Let's see. Here's just another version of some standing IT band stretches where the back leg, the leg is behind that you're trying to stretch. So in this person, it would be his left hip and IT band that they would be stretching here. And usually with these stretches, I'm usually telling people you could either do 10 times 10-second holds. You could do 3 for 30 seconds. Really whatever's most comfortable for you. You certainly want to make sure that the stretch is comfortable and not hurting you. If you do try and perform these stretches and they are hurting, definitely back off and potentially give us a call as well. I wasn't sure how we are on time, Steve, because I have like a bunch here.
Yeah, you could go through a few more. This is helpful.
All right,
absolutely.
Cool. So just kind of switching gears to the strengthening end. What I've done here is basically just kind of put together some exercises that are easy for people to do at home. So the first and most basic one would be your straight leg raise. It's important that you keep the foot pointed out forward, pointing towards you, I'm sorry. And that's going to really activate the quad and hip flexor. Those two regions tend to get a little bit weak when the person starts having some knee pain. And that usually occurs when the person isn't, fully weight bearing through the knee because it hurts, right? So that's something that, will definitely help out in terms of strengthening the leg and helping with some of the knee pain. Just gonna skip this one and we'll go to squats here. Squats is a functional movement that pretty much, most of us can do, and there's different ways of doing them. So on the left side, you'll see a version of a wall squat, and that person's just simply sliding up and down the wall, and that's really hitting some of your bigger muscle groups, so your quads, your hamstrings, your glutes, and even down to the calves. And then you could, if that's getting a little bit too easy, you can go into a regular body weight squat, and if you're really bold, you could start adding some weight. Usually, you kind of want to wrap the reps and sets around how comfortable you are. So, I always tell people to start with 10 and then base how you feel off that. So if 10 is too much, then go down to 8. If 10 is too easy, go to 12 or 15, and then do sets of that. So you could do 2 sets of 12, 3 sets of 15, 3 sets of 8, depending on if you're starting to use some resistance. If you're holding down at the bottom for a little bit, those can all activate different muscles a little bit differently, and certainly help strengthen up the leg and get the knee moving in the right direction. Let's see. One of my favorite ones actually is this last one here, step downs. So the way I kind of describe step downs is for folks who work out, right? And you're doing a bicep curl and you're bringing the arms up this way, the muscle's contracting and it's getting shorter. When the person's doing a step down, what's actually happening is the muscle is contracting, but it's getting longer. So if you were to hold that, if you're doing a bicep curl and you're holding the bar and slowly letting the bar go down or the dumbbells go down, that muscle is working a lot differently. It's a different type of contraction and it's a lot harder to complete. With step downs, that's exactly what's happening here. So we're challenging the quads, the hamstrings, and some of the other muscles in the lower extremity just significantly more than just your typical activities. And this is what's really going to strengthen up those tendons around and supporting the knee.
Super helpful.
Yeah. Yeah, we'll do one more. What the heck?
Awesome.
So the last one is lunges. This one is a little bit tough, especially if the knee is in pain. So it's a little bit more of a moderate level exercise. But I tell people, if you're first starting out, just keep your feet staggered and then don't try and take a step forward or back. Just keep your feet planted in one spot and then just simply drop down. And then as long as you're dropping straight down, your knee isn't going to go past the toe. And once again, you're going to hit all those key muscle groups. And if you're using some weight and you're going about it slowly and properly, you actually get some core strength in there as well, which is really cool. So
Great, thank you. So let me ask you, I'm going to go back to our screen here. So great exercises. Who is that for, and maybe who is it not for, right? We've got people, this broad spectrum of, conditions from the very simple to very complex or advanced conditions. You've got all different pain levels. You have, chronic versus acute conditions. So, who would those exercises be for? And then maybe, who needs, a medical intervention with Dr. Mejia or might need, can you talk to us a little bit about that?
Sure. Yeah. So the beauty with all those that I chose is pretty much anyone can do them, so long as use the pain level as your barrier.
Okay.
So anyone can really do those, so long as you can tolerate the discomfort. By all means, if that discomfort gets to be a little bit too much, certainly seek us out. But those exercises, generally speaking, those work for most of our knee patients, and that's why I chose them. Mm-hmm.
I appreciate it. That's helpful. And my question was kind of a loaded one, because I know that, while most people that maybe haven't been to our office or, just growing up, we learn, oh, you're in pain, stop, right? Stop, don't move, immobilize, raise up your foot, right? And stay on the couch, right? And, certainly, there are times where that's necessary to immobilize, certain fractures and things like that. But we know that it's really just the opposite, right? Just because we're in pain doesn't mean stop. We actually know we want you moving. We want you moving and working through that pain. It's a little counterintuitive, but it really does lead to strengthening and ultimate healing. So thanks for sharing that. Dr. Mejia, some of the interventions, so aside from some of the exercises and certainly our physical therapists like Dr. Guzzardi are heavy, very hands-on manual therapy, some of those IT band exercises, great exercises, but I know you guys work that IT band manually pretty heavily and nothing can replace that. You guys are great at that. Beyond that, the manual therapy and manipulations and exercises, what are some other treatments, some other modalities that are used in the office, and when are they used? What's sort of the medical algorithm for that?
Sure. Yeah, and the way I like to explain to patients, a lot of times what we do in physical therapy is really to support the structures around the knee and outside the knee, and the interventions, of course, address the actual, the interior of the joint. With regards to severity, I think, like Dr. Guzzardi mentioned, if there's a lot of pain and swelling, for example, that limits your ability to do some of these exercises and motions, those would be reasons to come in a little bit sooner rather than later, because it may be a result of an accumulation of fluid, for example, within the knee. And sometimes it requires actually physically, aspirating it out, numbing it up, putting a needle there and actually aspirating the fluid out to essentially decompress the joint. We may or may not do corticosteroid injections or cortisone right now, depending on the situation. But if there's a lot of inflammation, that can often be very helpful. There is, some thought that cortisone right now can suppress the immune system, but again, all injections are done on a case-by-case basis, and you have to weigh the risk versus the benefit. So aspiration and cortisone injections are one option. Beyond that, there are things like viscosupplementation or hyaluronic acid, which I would say is probably the most common intervention that we do in our clinic for knee pain. And that's basically, a series of injections that are given, to the joint space, and they act like a gel-like lubricant, essentially, a cushioning for the joint. As we mentioned about the conditions earlier, osteoarthritis or wear and tear of the knee joint is one of the most common things that we see. So adding a physical barrier essentially in between the two bones can help to reduce the friction, essentially mitigate the pain, and really hopefully delay or avoid the need for any surgical intervention, because once the cartilage wears thin and it's kind of end stage, so to speak, osteoarthritis, sometimes, surgical interventions such as a knee replacement may be warranted at that point. But the good news is that most patients that we treat through the combination of therapy, the injections, do really well. Beyond that, as another non-surgical type of treatment, you had mentioned earlier about regenerative medicine. Things like platelet-rich plasma and stem cell have often been used even in conjunction with some of the things that we just talked about, to help kind of promote healing in the area. Basically one of the things that is difficult for the body to heal is areas where there's not a great blood supply. For example, like a meniscus tear or, certain ligaments or even cartilage. If the blood flow can't get to that area, the body has a difficult time actually healing it. So things like platelet-rich plasma is taking your own blood, or stem cells, which are cells in your body which can promote healing, and injected into the area can be very helpful in addition to everything that we just talked about. So that's kind of the algorithm, some of the interventions that we can do, from basically non-surgical, even of course up to the surgical options if the patient is not improving with any of the above treatments.
Thank you. Yeah, that's awesome. And then on the physical therapy side as well, I mean, there are tools and modalities that you guys use, even aside from the therapeutic exercise and the hands-on, the manual therapy, things like EPAT, pulse shockwave therapy, the robotic laser for both extremity and spine, but is used for knee pain as well, correct?
Yeah, absolutely. And we've seen some tremendous results too, which is really awesome. We've had the laser for a little bit over a year now, or just about a year. And, with not just the knee, but other joints, the laser has helped out tremendously in providing pain relief and just really improving the tissue health and the blood flow to those regions. You had mentioned the EPAT as well. Once again, stimulate the blood flow and the inflammatory process intentionally at times to really get things going. And, what we've actually done is kind of create our own little niche where we're stacking something like regenerative medicine along with the laser or EPAT treatments to really kind of double up on some of those cases. And we've gotten really tremendous results, which is nice. Some of the other small things that we do as well is taping and strapping, where if someone needs to get immobilized for just a little bit, or we need to restrict motion, we've been doing that with great outcomes recently as well. So we really have almost every tool in the toolbox on the physical therapy end, which is great, along with some of our athletic trainer, Courtney, who's been great as well, really kind of giving us some outside of the box ideas. So it's really a great team approach on that side.
Yeah. Tons of techniques, tons of treatments, tons of tools and options, really, prior to surgery. And, it's interesting. I hear and have heard so often, Dr. Mejia, about patients who are going for meniscus surgery, mentioned torn meniscus. And, I've come to really learn and understand that there's very few, men our age, I'll put myself in your age category, that don't have a meniscus tear, that it's actually quite common, right? I won't mention the age, but you get to a certain age, especially in men, and you have a torn meniscus, may or may not even have pain associated with it. Is that correct?
Yeah, that's correct. And we talked about arriving at the right diagnosis. And a lot of times, these things, like say we got an MRI on a patient and they may show, like you said, a degenerative meniscus, but that may not be the actual generator of the pain.
Yep.
So you have to look at the patient as a whole. You use those results from the MRI to help you figure out what is actually generating the pain. But you're absolutely right that the treatments differ. They can differ, I should say, quite significantly depending on what structure is actually involved.
Yeah, yeah. Here's the other one I hear all the time is, well, I've got bone on bone, right? I've got bone on bone knee pain. So I need a total knee replacement. It's bone on bone, right? And oftentimes, we get the MRI, we look at the MRI and we're like, nah, that's not bone on bone, right? We hear things like, well, there's grinding. I feel grinding in my knee, or things like that. Can you speak to that for a moment?
Yeah, and that kind of relates to what we just talked about, that you still have to treat the patient. You may get an X-ray and it does show, quote unquote, bone on bone advanced degenerative arthritis, and it gives you an idea. Yes, the cartilage has worn thin, yet I've seen some patients with quote bone on bone arthritis and they have minimal discomfort. So you can't always go just based on the diagnostic testing. You have to kind of put everything together. Even if patients do present with pretty advanced or end stage osteoarthritis, it's still worth running the gamut, to be honest, of conservative management, physical therapy, anti-inflammatories, injections. And if they still fail all of those types of treatments, then they might be a candidate for total knee replacement. And the other thing with that is that most orthopedic surgeons would want that for their patients. They would want them to have tried all of the conservative management before they would even consider doing a total knee replacement, particularly given the pandemic.
Mm-hmm. Right. Absolutely. How about, you mentioned earlier ligament tears. I mean, we didn't really touch on that, but as far as, ACL, MCL, we've got, lots of athletes, and again, I hear all the time, tore my ACL, need surgery. Is a surgical intervention always required with ligament tear?
No, actually, particularly if it's a partial ligament tear. If there are still fibers intact, that can often be improved by physical therapy, by strengthening and stabilizing every structure that's around it. But regenerative medicine, in addition, if you're putting stem cells or platelet-rich plasma to promote healing in areas where there are poor blood supplies, like a tendon or a ligament, because there's not a lot of blood vessels that go to that area, so they may be very slow to heal. But if it's partial, potentially it could be treated non-surgically. On the other hand, of course, if it's a large rupture, that's a different story, because if the ends are not attached, then there's some instability there inherently within the joint space.
Mm-hmm. Yeah, that's helpful. Well, guys, I appreciate it so much, and I want to thank the participants as well. If there are any questions from the group, now would be a great time to squeeze those in. But otherwise, we're gonna wrap up, and I guess final words of maybe advice to someone who may be experiencing knee pain. Dr. Mejia, you mentioned ice and over-the-counter inflammatories, anti-inflammatories. Dr. Guzzardi shared some exercises. Other than that, and coming in to see us, any other final words or of recommendation?
Yeah. Sorry.
You know what? I'll just go real quick. Mine's brief. I just wanted to mention also about bracing. We didn't really touch on that. Bracing, is a very easy intervention that you can do by getting even something over the counter at the pharmacy. If you do have some instability or need some extra support of the joint, a knee sleeve or an over-the-counter brace can be helpful. As you get in a little more involved, there are more advanced and more specific types of braces that can help essentially unload the part of the joint that is degenerated. So that would require coming to the office and trialing the brace. But that's another aspect that I think can help a lot of patients with knee pain this time.
Helpful. Yeah, thank you for adding that. Dr. Guzzardi?
Yeah. So long as the injury is not an acute injury where there's some swelling involved, the key thing is, and I think we spoke about it a few times on previous webinars, is, keep the joint moving and keep yourself moving as much as you can, obviously within your limits, right? So if you are dealing with some discomfort, try some of the stretches, try some of the exercises, keep yourself mobile. And, if things happen to start increasing, certainly reach out. We have provided tremendous amounts of help, not just in the office, but through telehealth, and we've gotten very creative. So it's just been really awesome experience over the past month or so doing the telehealth.
Well, thank you guys. Thank you both for your time and your ongoing commitment. I know you've impacted many, many patient lives over your years of serving in your current roles, and you're great at what you do. So I appreciate it, and I appreciate you carving out some time, tonight to spend with us. So thank you guys, and I want to thank everybody who participated in the webinar as well. And we'll post the recording to Facebook and push it out. But if we can be of any assistance, please reach out and let us know. We'll do all that we can. So be well, stay safe, and keep moving.
Thank you.
Take care, guys.
Thank you.
Bye.